You can respect doctors, but still ask questions. This comes up quite a bit. Um, I think as a society, we're getting better at asking questions. Some of our seniors aren't as good at it, but their adult children certainly are. If your doctor is telling you something that doesn't feel right, it's okay to question them. It's okay to push a little bit. It's okay to say, but what if? And how come? And show me. Um, Doctors are more used to this nowadays than they used to be. I've been a nurse for 27 years, and back in the day, nobody questioned the doctors, except the nurses, of course. We always question the doctors. And thank goodness we do, because lives were saved because of it. But, doctors are people too. They don't know everything. And quite honestly, sometimes if they don't know something, rather than just saying they don't know, they will give you a vague answer, they will give you a wrong answer, or they will just avoid the question that you're asking them. That comes along with testing as well. I've had physicians that we've asked to do certain types of testing, and they've either refused to do it or have been very just not wanted to address it at all. And usually when that happens, it's because they don't know enough about that type of testing to know what the results are telling them. So rather than be embarrassed, they will sometimes tiptoe around it, avoid it altogether, or just kind of blow you off. But I absolutely question doctors all the time, very respectfully, because I do respect them because we work hand in hand. But if you don't feel like you're getting the answers that you're looking for, you need to dig a little bit deeper. Or maybe ask them, is there somebody else that would better be able to answer this question? If so, can you refer me to them? There's nothing wrong with that. None of us knows everything, and especially specialists. They have their area of expertise, and many things outside of that they don't know. I have worked with a variety of doctors in 27 years. And I do have to say, the ones that have impressed me the most have been the ER doctors that I knew, because they knew a lot about a lot of things, but weren't necessarily specialists in anything. And I have to say, trauma doctors, I've just, I mean, my mind has been blown many of times at how brilliant they are and just how quick on their feet that they can think and they can get things done. And again, they have to be that way, right? Trauma, it happens quick, and you have to be able to, answer it. So those have been the ones I've been the most impressed by. The ones that I found to be the most defensive are oncologists. And I've talked about this before. I respect all doctors, but oncologists, about 65% of their income comes from chemotherapy. So that's a little debatable. That's a little questionable in my opinion. And then neurologist and oncologist, I would say, are the two most defensive practitioners out there. I have a neurologist. I have a movement disorder that literally saved my life. I absolutely adore him. My life would not be the same without him. But he's not for everybody. He's not everybody's shot of whiskey or cup of tea, as they say. So if there's something that doesn't feel right, ask the questions. Or when the doctor walks out, ask the nurse. You deserve to have your questions answered. And if that doctor can't answer it the way you need it answered, then maybe that's not the doctor for you. I provide consulting. I have some of these tough conversations with doctors, and I also guide families with the questions to ask doctors. So if that sounds like something useful to you, reach out to us, and I'm here to serve. Take care.